This is Ideal Health Solutions, the podcast with Dr. Timothy L. Brown.
All right, welcome to Ideal Health Solutions, the podcast where we explore trends, challenges, and innovations shaping the future of healthcare leadership. I'm your host, Dr. Timothy Brown, and I appreciate you for listening in today. When we think about healthcare transformation, innovation isn't just a buzzword. It's the engine driving every meaningful breakthrough. But innovation alone isn't enough. The real revolution happens when technology, leadership, and strategy intersect to improve outcomes, create value, and transform how care is delivered. Today, we're diving into healthcare's innovation revolution. What's next for our health systems, how leaders can navigate the digital shift, and what it truly takes to make innovation sustainable. Joining me today is someone who understands how to bridge business fundamentals with cutting-edge innovation, Andy Strunk. Andy is a healthcare strategist and operator with nearly 30 years of experience helping organizations translate innovation into sustainable growth. As founder of Accretive Edge and with leadership roles at Google Health, Verily, and Salesforce, he's helped guide some of the most influential players in health tech, payers, and health systems. He's widely recognized for his insights on AI adoption, value-based care, and the future of digital transformation. Andy, it's an honor to have you with us today. All right, Andy, welcome to the show.
No, thanks, Tim. It's good to be here.
Absolutely. Well, look, I'm going to jump right in today, but I really appreciate you for taking time to come on and share with our audience your expertise. When you look across the healthcare industry, and we're talking about large systems, from large systems all the way to fast startups, what's driving the most meaningful innovation today? And how do we separate the hype from the true game changers, if you want to call it?
I appreciate the question, and thanks for having me on today. I think what's driving innovation, actually, the response itself doesn't feel that innovative. And what I mean by that is, health systems, tech companies, the buzz right now is talking about AI. And I think that it's important to note that health systems themselves, for example, aren't necessarily looking for an AI strategy or an AI solution. What's driving innovation is getting back to basics, and really health systems facing a shortfall in future reimbursements through some proposed legislation and some changes that are coming through. And I would say out of necessity is born innovation. So these health systems are really looking to solve core problems around rev cycle, coding, patient satisfaction, all of the drivers that contribute to fee-for-service payments, as well as payments through value-based contracts. And I would offer that organizations who are really driving innovation are the ones that have done the inward look, have understood where processes, people, programs aren't aligned and are not performing as well as they should, and have a clear understanding of where they need to be. And then and only then are they seeking out innovative solutions, inclusive of AI and other technologies.
That's amazing. I love how you talk about the inward work, because I think oftentimes that's missed when we go looking for AI solutions. We think the biggest, the best, the brightest, the most innovative, and then we end up failing at implementing these overall solutions. But that inward work is definitely necessary to make those game changes, if you want to call it, stand out in the industry. So I do appreciate you for doing that call out to that. You've worked with those major players, both from healthcare organizations to maybe those that are emerging innovators. Do you notice any shared mindsets or leadership traits among those who innovate most effectively?
Yeah, I think a common trait is the inclusion of participants in whatever technology change and adoption planning process is occurring. Those that include the frontline workers, the middle managers that are responsible for navigating resources effectively at their organizations, all the way through to executive sponsorship and leadership. Absolutely. And really making sure that the through line from all of those levels exists, and that the value is mapped for each of those stakeholder groups, all the way up through the KPIs that are on the boardroom wall and what the executives are going to be compensated for. So it's those organizations, so digital health providers themselves, who have done that work to identify the various players, to learn about their organizations that they're selling into. Those are the ones that really can frame the introduction of a solution in a meaningful way that then aligns with what folks on the receiving end at the healthcare delivery organizations are
Mhm.
looking to achieve. And there's a nice blending of business goals and technology adoption to achieve those goals.
That is super awesome. And I know we're going to dive a little bit deeper into understanding those goals for organizations and really how to delve into packing in why those KPIs are important in the conversation. But I want to shift gears because I know you had the experience of working at places like Google Health. I know there's a lot of buzzword around AI or in digital transformation, but the adoption gap is real. And I know we mentioned this just a little bit earlier, but based on your experience at maybe Google Health and Verily, what does successful AI integration actually look like in healthcare?
Yeah, I think it's first understanding the landscape and the TAM SAM SOM and really segmenting the market. I think that when thinking about AI solution sets, it's really understanding that only 9 to 10% of the US market is able to take on a platform as a service solution that includes AI
Mhm.
components to build themselves. I would offer that the majority of the market, looking for solutions that could be powered by AI, are really looking for managed solutions that solve a
Mhm.
particular pain point. And so, a lot of these organizations, the bulk of the market, may not have the know-how internally to build, but they do have the know-how to adopt technology. And so, I think just knowing your audience and knowing what to offer and how to modulate that really is key in this process.
Absolutely. And I think that's very true. Sometimes we bring these solutions that solve, in our mind, every problem, and then they kind of get thrown by the wayside. But what we're looking for is solving those specific entities. And then we can move into more of a broader solution, I think, over time. So I really believe that's awesome. For leaders who feel overwhelmed by that rapid pace of tech, where's the smartest place to start, from your opinion?
Well, I mean, we'll continue on with the example of AI since that is all the rage at the moment. Um, I think you have to get into the mindset of leaders and clinicians at the
Mhm.
healthcare delivery organizations. They take an oath, do no harm.
Mhm.
And so when thinking through that lens, looking for use cases and opportunities that can be introduced in a de-risked environment are the ones that are most palatable and likely the fastest path to adoption. So, and then so for an example, really looking at any of the back office operations, revenue cycle management, these are areas where there's tremendous opportunity to use the
Mhm.
compute power of AI, looking for coding opportunities, taking advantage of all the various levers that are built into various payer contracts, and using AI to help with that process is a great way to start. I'd say that as you get closer to direct patient care and in the clinical workflows, those are areas that there's a little more trepidation. That's where
Mhm.
if AI hallucinates,
Correct.
if there's any sort of glitch in the delivery of information, that's going to have a direct impact on patient care and could cause a risky situation and one that could have a harmful outcome for that patient. So I think that starting kind of at the periphery and looking at the business side of healthcare delivery is the safest, and then slowly working our way into clinical care delivery is probably the best path forward for AI solutions and other types of technologies.
Yeah, I think you called out two major players that I don't know of any organization that has done that well, and that's revenue cycle management. I think that's one of the biggest areas that we could all do better in healthcare. How do we get our patients to pay these enormous bills when they're getting 4 or 5 bills in the mail that read for the same appointment that they may have gone to? I've heard that conversation go several different ways, and it's been one that we're all struggling, I believe, in the healthcare industry to really identify. So for all of our AI generators, AI integrators, if you have something for revenue cycle management, that is gold right now in healthcare for sure. So I
Yeah,
want to talk a little bit. Go ahead, sorry.
yeah, I was just going to offer too. It is kind of an arms race if you think about it. It will be interesting over time to see taking the rev cycle management use
Mm-hmm.
case a step further. You know, the provider organizations themselves are using AI tools to help with appropriate coding and getting fully
Correct.
reimbursed for the services that are delivered. At the same time, the payers are now recognizing that people that are spending that money, so the provider organizations,
Mm-hmm.
are getting savvier about getting reimbursed, and therefore the payers needing to pay more out than perhaps has been the norm. You'll see this tension now that payers could be using AI to counteract that aggressive and appropriate coding by the providers
Mm-hmm.
to accelerate claims denials. And so I think it's this interesting tension where
Agreed.
a new technology comes out, we have different players with different motivations, and how
Correct.
the same tool sets are going to be used to keep each side of the business healthy from their own perspective. And so I don't know what that's going to look like in the long run. There's going to have to be some sort of point at which these entities come together and work together. But right now, what we're seeing is more aggressive denials, and that's going to be especially true going into 2026 with some of the changes that are coming from the One Beautiful Bill.
You are absolutely right. And I appreciate you for bringing that point out as well. Shifting gears a little bit. Now, I know that you have helped organizations translate innovation into sustainable growth, which is easier said than done, of course. What's the most common mistakes you see health systems make when trying to scale innovation?
Yeah, I think that vendors that are offering a technology solution need to go in with a mindset not of a pilot, but one of an early commercialization partner, where the focus and the
Interesting.
expectation is set on landing the first small cohort that's going to use the software, finding hyper-localized data to support the efficacy and the impact of that technology to
Mm-hmm.
then use for internal marketing purposes, because there's no better marketing materials than your colleague down the hall saying the impact that this particular software or other technology had on patient care to get
That's
the next
absolutely
unit, the
true.
next unit, and the next unit interested in using the innovation.
That is so true, and it kind of goes into the understanding of your organization's culture too. And I'm going to ask you a question about that as well. But just from your perspective, how does culture influence whether innovation thrives or stalls?
Yeah, I think you want to make sure that you are thoughtfully choosing where you start your early
Mm,
commercialization efforts within a healthcare
so
delivery
true.
organization. There are certain disciplines that are more open to change and doing small tests of change. Sometimes age of the clinician comes into play. Some folks are a little
Mm,
more set in their ways. There's certain folks that are more tolerant of new interventions and trying things out.
mhm.
So it's really, as a vendor, trying to get into your point, the culture of the organization, asking nursing leadership, asking medical leadership, asking others, who are the innovators within our system, who is willing to tolerate the imperfections of a new technology as things get ironed out. And then it's just a matter of prioritizing those people first to build your proof points, to smooth out the wrinkles, to then have a smoother implementation with subsequent groups that maybe aren't as tolerant for early stage interventions.
I love the way you worded that, tolerant of the innovation. Because with any new technology, whether it's AI generated, whether it's just a new system and all, there are going to be hiccups. And I think that's the realness of any new implementation. Nothing's going to be 100% perfect. And we have to understand that, especially in healthcare, there are risks that are associated with integrating any type of AI or any type of new digital platform into your organization. That's totally understandable. But you have to find those key players that are willing to take on that risk and willing to help maybe the vendors as well as they're building out the case to use or to utilize that overall software or AI generated solution that they offer. So great call out. Welcome back. Just remember, if you have not already, please subscribe to our page. We are located on all the social media platforms, Ideal Health Solutions podcast, also located on LinkedIn on Ideal Health Solutions. So please feel free to subscribe. We have several episodes that we have some great information, not only for healthcare leaders, but for innovators across the board. So please take that time to subscribe, like, share, and also comment on today's video as well. Now, I have Andy Strunk here today who's going to talk to us a little bit about the innovations and value-based care. So I want to talk to you about that. How do you see these two forces shaping each other in the years ahead?
Yeah, it's the $1 million plus question. I think that
Absolutely.
there certainly is an appetite by the current administration and just a recognition by payers in general that the costs are out of control right now. And so there's a will to go down the path of value-based care.
Hmm.
I wonder though how long it's going to take for that to come into play in any sort of meaningful way. So, for example, the thrust of value-based care is really, how do we keep the patients, the members in this case, profitable under kind of a capitated payment. And so I think that innovation that helps from a profitability standpoint, I know that it's not totally popular to mix business terms with patient care, but that's the reality of it if we're talking to executive
That's
leadership
absolutely
at
right.
organizations here. But really understanding how to keep that patient profitable. And so innovations that help really identify all previous care that has occurred, regardless of care setting, synthesizing that and bringing up relevant results, insights, anything that can help in clinician decision making, especially when it comes to ordering additional diagnostic tests,
Hmm.
studies, anything to that effect. The whole idea around value-based care is to reduce unnecessary spend. And so being able to surface what has already been done in the past can be quite powerful to help with decision making to avoid ordering redundant and subsequently in these contracts unreimbursable or not net new reimbursable
Hmm.
activities. So I think that I will say that this is an interesting moment too, because this is a very rough estimate, but call it 10, 12% of payments in the US market are made through value-based contracts. Well, that
Hmm.
means that 90+% or 90% approximately of payments are through fee for service and quantity of services. So this is where it gets interesting if you are in any
Hmm.
sort of sales motion on the vendor side and talking to health system leadership. Part of your presentation needs to speak to your ability to help them on their journey to value-based care. So that is
Hmm.
keeping patients profitable in largely a capitated situation. At the same time, the same CFO sitting at the table is also going to say, well, 90% of my business comes from fee for service. How do you help me then
Correct.
subsequently increase utilization? So there's this interesting tension that will persist until perhaps value-based care wins the day or whatever happens in the future. But I think that innovation that supports the profitability of patients while also out of the other side of their mouth being able to say that they support actual utilization for a different payer set of circumstances is probably what's going to win the day.
It's amazing. In my mind, as you were talking, I'm thinking politician, because you have to. There's two sides to every coin. Understanding that when you come into the vendor side, so it is a teeter totter of and balancing of the scales, if you want to call it, as you're building out your own innovations. And this speaking directly to vendors and understanding how to influence the leaders and bring in the right information. You do have to understand how scales are going to be balanced, especially when it comes down to value-based care. And one more question before we jump from there. And this could be yes or no. You can actually go into an explanation. Will value-based models finally make innovation feel less optional and more like an operational necessity?
I think it's going to be an operational necessity. And the reason I say that is if you look at the biggest players in healthcare IT today, those would be the EHR players. Those
Mm-hmm.
systems were built over time in a fee-for-service model, and their near sole purpose was to capture enough information for billing purposes. That, at its core, is what today's modern EHR does, especially in the
Mm-hmm.
US market in particular. I think that lends itself to a non-value based system. And therefore, that makes it an operational necessity to look for innovative solutions that can complement the core EHR system of record, but that treat and approach caregiving and the stewardship of financial resources in care delivery. The market will be needing solutions that are aside from the EHRs themselves to navigate that work, since they simply weren't designed for that purpose initially.
Yeah, one thing that comes to mind as we're building out any type of innovation for healthcare is understanding the people that will be utilizing the overall software innovation, technology, digital platform. How do you identify those key people, and why is it important to identify the key people? Where do you think they fall in this conversation of implementing these solutions for healthcare in the future?
Yeah, it's important. The selling motion into healthcare delivery organizations, if anybody watching has done this work before,
Mhm.
it's a known thing that this can be a 12, 18-month process. And
Correct.
one of the reasons for that is simply because the the vendor themselves needs to be doing a lot of discovery work at the target customer and really asking the questions, understanding the relationship and the culture of physicians and nurses and how they work together, physicians and pharmacists, physicians and
Mhm.
other ancillary services. So it's all in each organization. There's going to be different formal and informal power brokers, and
Mhm.
it just takes time to understand that. Once the vendor has done a thorough job of that, they will have a political map that they can use then to identify how to deploy, who to involve, and how to build out a project management office for ultimate implementation. But I think at every step of the way, you as a salesperson or a vendor really want an executive champion that you can check in with that can unlock the
Mhm.
doors across the organization. And there should be a constant process of checking. Here's the information we've discovered. Here's our hypothesis as a third party on how we would approach this. Are you seeing it the same way from the inside? And just that constant
Mhm.
testing as you're building out the plans. Um, in doing so, then you get the power users, you get the laggards, you get the resistors. You kind of understand what you're up against, and that's a pretty negative connotation. But what you're going to encounter when you go to deploy and implement the software, and there's mitigation plans for each one of those types of individuals that you can build out and work with.
And it's amazing you approach that from the vendor side, which is so important of understanding how things work. I want to go a little bit deeper. Internally, how is that person also important on the internal side for bringing in innovation for an organization? Because I think they really play a dual role for helping not only bringing innovation into the organization, but also helping, as you mentioned, vendors as they're building out these solutions to ensure that they are solutions that meet the needs of the organization. So talk about internally how that key person or key individuals play a duality role, if you want to, internally as well.
Yeah, I mean, looking at the way that CIOs run their organizations, that has shifted in terms of the kind of everything is in the EHR versus best of breed. And I'd
Mhm.
say that, until 8, 10 years ago, there was a real push towards everything is the EHR and the modules that the EHR has promised us on the roadmap. And
Mhm.
as a result, the CIO is a little bit more skewed towards command and control, and just really going all in on the EHR vendor. And there were very good reasons for that, given the large investments that were made, future credits that were banked as part of the contracts. So utilizing that forward payment and whatever was baked into the contracts made sense through the EHR lens. Over the past 8, 10 years, there's been a loosening of that where CIOs are now more open to service line leaders bringing solutions forward that they see on their own. Perhaps they've been at a conference, maybe they've read something online, but
Mhm.
the internal champions can now come from the service lines themselves, and they can really be at any level.
So
I bring
true.
that up because it's the people that will be using the software now that are more empowered than they had been previously to identify solutions, bring them forward, and as a result, then they're more bought in as the new technology advances through the purchasing process, and ideally, once the purchase is made, through the implementation process. Because I think there's a sense of ownership, there's a sense of I've put time and effort into this, and now I want to see it come to fruition. That is the emerging role of folks that don't sit in the IT shop necessarily, but can really
Absolutely.
advocate for the various service areas.
I mean, spot on. Understanding these individuals in your organizations, they have a lot of power, not only just to bring the innovation in, but absolutely to make it successful in the organization and to see it as they're pushing forward. Oftentimes, you see these innovations or these ideas are building on your overall KPIs for your organization, but the people that are executing the work, doing the actual work, the day to day work, you need these champions on your side, whether you're internal or external, in order to see these solutions be successful across the board. Looking ahead, Andy, I just have a few more questions for you. Where do you think healthcare innovation will have the biggest impact in the next, let's say, 5 years, based on patient experience, operations, or somewhere unexpected?
Yeah, I think there's an opportunity and there's some movement towards more of a value-based arrangement. And writ large in the US market, I think that there is more and more space for focus on preventive medicine than there ever
Mhm.
has been before.
Absolutely.
There are new emerging technologies that help clinicians not prescribe the snake oil or kind of what that traditionally has been called in the past, but true interventions that could be preventive in nature that previously didn't have their moment in the limelight. And I think that with
Mhm.
various reimbursement codes, emphasis on reducing sick span and increasing healthy longevity, I think there's both a push on the provider side and the way that they get
Mhm.
compensated, but there's also a growing educated consumer market out there that's really
Correct.
intrigued with the longevity movement and staying healthy. So I think that solutions that can assist with credible innovation in preventive medicine and longevity, I think their day is coming to really be highlighted and be embraced both by the consumer and by the folks that deliver the healthcare services themselves.
I wholeheartedly agree. I think about healthcare in my parents and my grandparents' age. They didn't have the internet. They didn't think about researching what the doctor or whatever their diagnosis was. Our generation here, we are all about, okay, you tell me what my symptoms are. I'm going to go straight to WebMD. I'm going to Google. I'm going to ask ChatGPT what's going on. And they're going to give me a solution that I'm going to bring to the doctor's office. So oftentimes we come with a pre-diagnosis, if you want to call it,
Yeah.
that we've researched online, and we want to know what that actually means. And it puts our healthcare leaders, our physicians on the spot to be able to answer those questions. And they need that AI generated information to be able to intelligently speak to some of this and maybe debunk some of the myths that we identify by doing a quick Google search on our symptoms. So I think this is going to be an interesting interesting wave for the healthcare industry over the next 5 years.
Yeah.
If you could predict one trend leaders must prepare for now, what would it be, Andy?
I think it's the millennial generation and the younger people recognizing that they are growing up in an environment that is less conducive to human life. From looking at
So
increasing
true.
temperatures, there's a fascination around microplastics and what that's doing to the human body.
Mhm.
I think that the trend is really being responsive to, and it's not just millennials and younger folks. I mean, it really is anybody that's paying attention to what their body is ingesting environmentally and how that interplays with their genetic makeup. I think the trend really is what comfort, what services can be provided to those folks, either in the form of screening if you have a greater risk of developing a chronic disease, or just generally accelerating research on these areas and what the impact on some of these environmental changes is having on the human body, and being able to get ahead of
Absolutely.
that and provide people fact-based information so that they know how to navigate kind of this new world.
Yeah, it's almost scary how quickly things are transforming, and the amount of information that we have available at our fingertips. And like you said, honestly, it is scary because now we're at the stage of how do we get ahead of that? And if we are not the innovators that have the information, that have the technology to be able to get in front, we'll be left behind, and we'll be trying to pick up the pieces of what happens when you don't have the leaders that need to be in the forefront making the decisions. So I think that's a great call out of how to kind of predict one trend that we need to definitely be pushing for, and maybe really the case for why it's important to have AI and digital solutions available in the healthcare industry. So nice work. Before we close, I want to tap into your strategic lens. What advice would you give healthcare leaders trying to champion innovation inside environments that are really slow to adapt or are really what we would call risk averse?
Yeah, it could lend ourselves back to some of the earlier discussion around where innovation is deployed. And if you are working at a very risk averse organization and you have an appetite to bring in AI as an example, find some of the de-risk use cases or ones that won't have direct impact potentially negatively on patient care. And I think that really is the hot area right now, meaning that in clinical care delivery, you want to be as close to perfect as possible with your solution. So I think just choosing the use cases that the organization's risk profile will tolerate is the right way to go. And some of those safer areas are in the administrative areas, rev cycle, contracts management, things like that. They may not be the most exciting, but they will have meaningful impact on the organization. And then perhaps as local results are shown, and there's some benefit to that particular environment and that culture, it could give folks the comfort to take on the next project that gets a little bit more proximal to the patient care pathway, and the next and the next and the next. That could be a process to follow.
Absolutely. My last question, and I want to learn a little bit about what's coming up for you as well. How do you keep your teams inspired when change fatigue starts to set in? Because we know it's going to happen. Change is going to rapidly come in the healthcare industry. We're going to start implementing all of these new AI generated solutions and digital solutions, and we're just going to get completely overwhelmed. How do you motivate those teams that may already be there or they're starting to experience that?
It's mapping the value of the proposed solution to the folks that are going to be using it. So again, it gets back to the earlier comments. The innovation discussion here, the answers aren't that innovative. It's getting back to basics and looking at people, processes, programs that are in place. Where are people struggling? And just focus on that as a starting point. And it's amazing when motivated and you're solving a particular pain point that you've understood, articulated, and now come in to solve for. I think it could get people excited again about the rapid pace of innovation. The risk really is just throwing new innovative solutions at people without understanding their context, their needs, and really what they would prioritize to do their jobs better. So fundamentals, back to basics, just identifying problems and finding solutions that solve those core problems and problems that are really highly prioritized by the people that will be using the solutions. That's a big part of the winning strategy.
Absolutely. Keeping people in their proper place, which is at the forefront of every innovative solution. I think that's amazing to understand. And then if you understand people, which healthcare is a people industry, a people driven industry, then you absolutely can understand how to implement these in a plausible way that incorporates their understandings of how to utilize the technology, but also the big picture of ensuring that we do no harm to our patients and provide excellent care as we're making these strides to make better and healthier communities. Andy, this has been amazing. Thank you so much. Tell our audience how they can get in contact with you, what's coming up in your world so that we know and can keep and follow you as well.
Yeah, can be in touch through my website, accretiveedge.com. That's the fractional strategic execution services firm that I run. I'm going to be focused on my core mission, and that's really helping companies with commercialization and go-to-market strategies for new software technology solutions for the healthcare delivery organizations and payer organizations. So that's really my sweet spot. I love to help with innovation as an entrepreneur at large companies, looking for new use cases on platforms and really getting out into the field and getting health systems excited about using them.
Absolutely. Well, like I said, this has been absolutely incredible. Thank you so much for joining us today and sharing your knowledge, your expertise in this field of healthcare innovation. I believe that many people will be able to understand and grasp the concepts that you pulled into today's conversation. So I'm forever grateful to you. And I look forward to hopefully connecting with you soon in the future to see what's coming down the edge or down the pipeline for Accretive Edge as well. Thank you so much.
Thank you. It's been fun.
Awesome. This was an incredible conversation with Andy Strunk. What I appreciate most is how grounded his insights are. Innovation isn't just about the newest tool or trend. It's about creating transformation that lasts. Today reminds us that real innovation is leadership discipline. It requires clarity, courage, collaboration, and a commitment to delivering value for the people and communities we serve. A huge shout out and thank you to Andy Strunk for joining us on today's episode of Ideal Health Solutions, the podcast. If today's conversation sparked an idea or inspired your leadership journey, please take a moment to like, share, and subscribe. Connect with us on LinkedIn, Instagram, and TikTok for more insights on innovation, leadership, and purpose in healthcare. Until next time, keep leading with vision and never stop innovating.
If you enjoyed today's episode, be sure to follow Ideal Health Solutions, the podcast, wherever you listen. You can also connect with me on LinkedIn for more insights on leadership, health, and transformation. Until next time, stay inspired, stay focused, and remember, even in uncertainty, there's opportunity.